I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
If everybody's all right, we're gonna go ahead and go out of order, and we're gonna do the CON vote first. And then we'll go back to the agenda. CON vote. This has to be a roll call vote. Jonathan will read the names when we get to that. Please make sure you speak into the mic or speak loud enough because it's being recorded so that we can transcribe it to send in. So the CON committee was Bob McKenzie, Ron Smith, myself, and James Barr. And we bring forth this. The CON committee brings forth a seconded motion to approve the transfer of operating authority from Phil Gray, Inc., doing business as Seaway Valley Ambulance Service, to Governor Rescue Squad Incorporated. That is the motion. I will now open it up for any questions from the REMSCO members. Any questions? Not hearing any, we will go to, I'll ask if there's any conflicts of interest.
Can you unmute?
Are there any conflicts of interest on this vote?
Yes, there is a conflict. I will not be voting as I'm the operations manager for that outfit.
And who's speaking, please?
James McGrath.
James McGrath is doing the conflict of interest due to his position there.
I'm going to declare a conflict of interest. I have a financial agreement with Seaway Valley Ambulance.
Bruce Wright is declaring a conflict of interest. Are there any other conflicts of interest? Not hearing any, we'll go ahead with a roll call vote.
James Barr,
Yes.
Paul Barter,
Yes.
Mark Devers,
Yes.
Ken Gardner,
Yes.
Larry Gerard,
Yes.
Bretton Grove,
Yes.
Robert McKenzie,
Yes.
James McGrath is an abstain. Neil Rivenberg,
Yes.
Bobby Simpson,
Yes.
Debbie Singleton,
Yes.
Ron Smith,
Yes.
Dottie Suter,
Yes.
Mark Tuttle,
Yes.
Bruce Wright, I assume abstain.
Yes.
Matt Yelton.
Yes.
The motion passes 2 abstentions and 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14 in favor.
Okay, thank you so much. And my understanding is there's gonna be another one coming after this one, for them as well, some things they're doing, but this was the first part of it, so. Thank you, everybody. We'll let the reporters, you're good to go. I knew it wasn't gonna, it took you longer to set everything up than it did.
I'm working on the list of the people not here for you right now.
Okay, by the time I'm got all my stuff together.
Okay,
Thank you.
we're going to, minutes from our April 6th meeting. Any questions, any changes, additions?
Make motion to accept the minutes.
Second.
Bobby Simpson made a motion, seconded by Mark Tuttle, to accept the minutes. I'm gonna ask for the folks up in, St. Lawrence County. I'm gonna go with, are there any abstentions? So if there's abstentions, I'm gonna ask you to raise your hand at this time. Not hearing any, motion carries. Treasurer's report.
Everybody should have a copy of the treasurer's report. Any questions?
Questions on the treasurer's report? This only covers funds through June.
Correct.
June,
Funds from June.
because because the state has not adopted a budget, they won't pay out anything for the current year. So we have them all set to go. I've done all the paperwork that they made us do again. All that has been completed. The vouchers are ready, so as soon as they adopt the state budget, then we can submit. So we'll have 3 quarters to submit.
Second, probably by the time it comes through, we'll be able to submit for all.
So,
And it'll be with actuals versus estimated budget, so you'll look.
so as soon as, that is done, we will, move on that. Do we have a motion to accept the treasurer's report? It was sent out ahead of time.
Move it. Second.
Motion by Neil, seconded by Larry. Any people up in St. Lawrence County opposed? Not hearing any, so carried. Enforcement list,
It's a big one.
and it's gonna take me a long time to read this one. There's only one since our April meeting on there. Dated 5/7/26, of Brett Cullen from Pine Bush, New York. 800.16A2, negligent in the performance of his or her duties and practice. And 800.16A4, has abused a patient. Was suspended for 3 years, effective 5/6/26. Any other correspondence? Any other correspondence? We will go into committee reports. Mark, we'll let you go first since Mercy went first with the
Okay.
remake.
Be short and sweet, unless someone has a question, nothing to report on behalf of Air Methods.
Would like to thank them. They came around for EMS week and left goodies at all the stations. That was very nice. Thank them for that. It's greatly appreciated. The crews appreciated it. Over to you, Matt.
All right, so June 27th is our 10-year anniversary at Rome. We're doing an open ribbon cutting event right at Griffiths. December 2nd, Vernon Downs is our fall education day. We get actually a lot of people.
December.
Sorry, October. Looked at the 10 and the 2 and put them together. October 2nd, it'll be the first Friday of October. We do our Vernon Downs Education Day. A lot of people from the North Country come down, so I'll keep everybody in the loop. And then October 23rd is our trunk or treat event. I know it's a far cry south for you guys, so if you do get a chance to go down there, we're having an open house and our trunk or treat event. That's it.
Any questions for either of the air methods or for Mercy Flight? Not hearing any, we'll move on. Auditing committee, we're putting together the final figures from Spring Fling. There was a couple things outstanding. We will get those taken care of. We've also refunded the money from a couple of the CONs. I'll be working with Lindsay because I believe that maybe Natural Bridge owes us a little money because of the second round, but we'll check that and get that sent out to them to get that taken care of. We did the CON already. Executive, we had a brief meeting with Dr. Delaney prior to the REMAC and went over a couple things that Jonathan will cover under his program agency report. Fort Drum. No one here. Nothing under Gen Z. Chris, legislation?
There's a bunch of bills that are just starting in committees dealing with community care medicine. There's a whole bunch trying to give tax incentives, varying amounts, couple $100 or $800 all the way up to $2,500. The throughway exemption is making its way again to pass, so none of them are making a whole lot of headway. There's, again, just very beginning in the legislative process.
This is state.
State.
Yep, I did get an email today that, through the volunteer firemen's, insurance company, that the, that tax credit incentive the increase from 200 to 800
Mhm.
was passed in the House and the Senate, and it's just waiting the governor's signature. I found that interesting.
The assembly and the, oh, the state, not the federal, okay.
Yeah,
State.
the state, it was a, you know how you get a tax, you get the big $200 if you're
Yep.
a volunteer fireman or
Yep.
EMS worker, they're gonna bump it to $800.
Yeah, there's like 3 or 4 that are
If
pending
the,
for varying amounts.
if the governor signs it.
Performance measures, Chris?
We haven't had a meeting because Neil's been off. It's blaming me, wow. We blamed you last month too. No, we have not, we really have to get back on that. So we're getting some good answers. As you know, we're doing that, what's the word, I always screw this up, make the counties have to do that study, what's that? Yes, so we're getting some, I think, some good, what we're doing in Jefferson County is talking to every transporting service, and we're reaching out to as many first responders that will talk to me. And trying to get some answers from them. There's like a 4-page questionnaire that we've developed. And it asks a lot of different questions in a lot of different ways. So it's kind of interesting to hear what some of the folks have in mind. I think some of that might be useful. As far as a performance measure, what can be used for performance measures. But I think we need to start tackling that again and see if we can't come up with some proposal of how do we measure our system? How do we really make sure, how do we ensure that we're really doing a good job? And, you know, it's kind of that yardstick that we're measuring against.
Peter, Bob, we gave out awards at, Spring Fling. They seem to go over very well. Those people will be sent to the state. That's due, I think, July 1st. I had to get those typed up and submitted to the state. So we'll submit those folks to the state for the awards in October at State Vital Signs Program Agency.
Okay. All right, so here's program agency report. So medical director change, SUNY Canton to Dr. Holland. This was approved by the REMAC, so it comes forward to the REMSCO as a seconded motion. So we need a motion. No, we just need a vote on it, sorry. So all in favor of SUNY Canton changing to Dr. Holland? Any opposition? Problem is, I can't see the other people.
Is that your ambulance? Just out of curiosity.
It's a BLSFR.
Any objections up in St. Lawrence County for that?
Aggressively shaking.
No.
Carrie.
Pad update, so we have a new one in the town of Teresa, so we'll get that forwarded over to the county so they're aware of it. BLS regional adjuncts, so the REMAC approved Beaver Falls IGEL training program. So IGEL is handled a little bit differently than what the rest of the adjuncts will be for the region. For the rest of the adjuncts, you approve them doing the adjuncts. For IGEL, you approve them doing the training. And then the state gives the final blessing, but they can't final bless it until the REMAC signs off on their training. So this led into a larger conversation and some work for our office to do, but we're gonna build a generic training that can be adopted by the REMAC in this body for IGEL training. So that way every agency doesn't have to keep reinventing the wheel. They can just use the generic training. Dr. Gerling, who we work with on the Mountain Lake side, he's the medical director for Skeesboro, and he works at Albany Med, developed a training with them. Why reinvent the wheel? They've already said we could use it, so let's just use theirs. So I'll just adapt it and it'll be out for review by the REMAC and then the REMSCO as well. But it comes as a seconded motion to approve Beaver Falls training. We've reviewed it. Dr. Delaney's reviewed it. It's very comprehensive. It's meets the metrics of everything that it needs to be. So I'd appreciate a vote on that.
Any oppositions up in St. Lawrence County?
vigorously shaking
No.
their head.
Any oppositions here?
Perfect. So I'll talk more about this later, but we have rolled out the second part of our paramedic scholarship program. We actually meet tomorrow. We have a steering committee, which is 3 people from the Mountain Lakes and 3 people from the North Country councils, 1 educator, 1 person from the general council, and 1 person from the training and ed committee from each region. We received 9 applications for the first wave of it, which we were really happy about because it was a pretty tight turnaround to get them in. There's some pretty solid applications, so I look forward to the discussion we have with the committee tomorrow, and to get them out. And then we've already rolled out the second phase, which applications are due July 1st. So if you have anybody who is going into the paramedic program, the paramedic program is not tied to the region. The applicant's residency, though, is tied to the region and their commitment to come back and work in our region, either the Mountain Lake side or the countryside. So they can take a paramedic class anywhere in the state. We will fund it. They just have to commit to coming back here and working. Again, also, and I'll talk more about this, recruitment and retention initiatives. As you can see, Carthage has jumped on the bandwagon. We are working with Debbie, provided their South Jeff's policy on this. So agencies have to adopt a policy for doing the EMS internship program. It has to be resubmitted every year. Again, why reinvent the wheel? South Jeff has a policy that works really solidly, that can be easily adapted to any of our agencies throughout the region. My fear is a lot of our smaller agencies aren't going to take advantage of these kinds of initiatives because they don't have time to develop a policy that has to be resubmitted every year. So if we as a region can offer that to them, that's just another tool for them to use to be able to actually engage people in their communities to get them involved in their agencies. And we've gotten some okay feedback on this in agency participation, and I'm gonna reach out, Paul, I'm warning you, to our course sponsors, and do some partnership with them as well to try to stem some more people to do the internship program. Training, Debbie, you wanna just roll in spring fling into this? I'll let you talk.
So, this was our 25th, annual spring fling. We had 119 attendees. We've had a lot of positive feedback. We had the most vendors that we've ever had. And we had some new vendors and people seem to really appreciate that.
We actually sold out the vendor room and a lot of them have committed to coming back next year. And we've already gotten some new vendors that have reached out and has me going, oh crap, where are we gonna put them all? So it's a good problem to have.
Yeah, so we made, we can always go up in the hallway up above. I guess we could always put some up there. So we, we'll make it work.
Yeah, the weather's as nice as it was this time. We'll put them outside.
We're very fortunate that, Edgewood lets us come in and just take over their kitchen and everything and set up and do everything that we do. So we really appreciate it. A lot of positive from the folks that were there. And we've already got some leads for some topics for next year. So, we'll be working on that, getting that all put together. And our goal is to have it out, the beginning of January again for next year. We didn't have any on-site registrations. That was something new that we offered this year. If you remember, we talked about that and offered on-site. And we didn't have anybody take advantage of it. We were set if somebody would have, so I think we probably keep that. And continue the on-site. Maybe somebody will want to do that, but we saw a couple of things that we're going to enhance for our speakers. Have some things posted in the office there with who's on when, because we had a little foobar with somebody that was supposed to be there to speak, didn't realize he was there the second day, but we worked through it. It all worked out. So thank you for those council members that came up and gave us time and helped us do registrations and scanning and all that, because that certainly is much needed. So thank you. I think the banquet was very nice. We had a lot of people at the banquet, so that was a good turnout. all in all, I think it was a very effective,
Yeah, I think things went really well, went very smoothly, knock on wood. That'll hopefully be a trend moving forward. It's kind of like riding a bike. We fall off a couple times when we get started, but once we get moving, we're good. So the next training that we have coming up is gonna be Fort Drum EMS Day, which is gonna be this Saturday. Registration for that closed this morning with 19 of the 20 spots filled. A cool thing that we are able to offer with this one, utilizing some of our recruitment and retention funds that we have, is we are able to purchase ASHI ACLS cards. So as part of the EMS day, they'll actually go through and get their ACLS in the morning, and then we'll roll into the training scenarios that are throughout the day. Amanda and I have made some very good training scenarios that,
Very critical thinking phase.
and.
They're not times.
They're, yeah,
so if you remember in the past, we have picked up the lunch for that. And Jonathan didn't need that this year, but I would like to propose that maybe we do some snacks for the morning and afternoon. To support this, as it is, underneath. In our region, and it's done by our program agency. I think it would be nice if we, took a couple $100 and got donuts and coffee in the morning and maybe some kind of snack for the afternoon for you.
okay. I won't complain. I like donuts and I'm okay with coffee, but I like donuts.
So if somebody would like to maybe make that in the form of a motion, that would be greatly appreciated.
You have a dollar amount you.
I was thinking 200.
Make motion to allocate $20 for snacks.
Anybody up in St. Lawrence County, any questions?
Vigorously shaking that.
No.
Any oppositions? Any oppositions here?
Well, thank you.
You're welcome.
And then some trainings that'll be coming soon to the learning management system that Amanda's been busting her hump on, and they're solid trainings. Debbie's can attest. She's reviewed all of them for her. So the many faces of shock, when the pump fails, and it's more than a bone.
There's no time frame where the pump fails.
That's the one that we're having issues with.
Yeah, I'm having problems with high spring with it, so I
Oh,
don't
okay.
know when that will go up. Paul approved that like 6 months ago. I just can't get high spring.
By the time we get it to go up, we'll have to probably read that.
The many faces of shock, she's done 4 different trainings for each of the forms of shock, and they're very, very good. And she's got quizzes that go with them, so people can get some credit for it. So, she's put a lot of time in it. She's done a really nice job. It's very refreshing having training going up into the learning management system and showing that that's getting done, so.
Then just miscellaneous things. I still forgot to update the meeting dates. So we go again in September. It'll be one day I'll remember to update state EMS meeting dates. That day is not today. So the next meetings are in September. They are the 15th and 16th. Happy birthday to me. I get to be in Albany for it.
We'll celebrate.
It'll be so much. And Troy, get to be in Troy for it. Woo-hoo. And then other things that were participated in, and again, a reminder, because this is still occasionally being a problem, is that paperwork needs to be submitted to the paperwork address, not just to Amanda or just to me or just to Zach. Because if you email me and you send something to Amanda, I might not know what the hell you're talking about.
It happened
So,
today, honestly.
Yeah.
I emailed the paperwork email and then emailed Zach individually, and I had already handled it, so.
please use paperwork email. Any questions for the program agency? Awesome.
Neil, anything under safety? I know you just come
I can't
back,
think of
so-
anything good to blame Chris Weathers or safety. Probably for the same reason he blamed me, that there was whatever was the
Performance.
quality performance metrics there were, in 2026, there has been no CISM outings. We have some fluctuations in people in the team. Nothing that the chair and I didn't expect to have happen at some point in time. And we took that advantage to reach out to every individual and talk to them about their participation or lack thereof. We have about an 80-20 rule. 20% of the people are doing 80% of the work and 80% of the people are kicking back appreciating it, I guess. So yeah, I don't have much to report. I'm working on 3 TED Talks from my little adventure with, sepsis. The first one is, go see a podiatrist. The second one is, save your sick time. And the third one is, you're not dead till your wife says you're dead. So if anybody's interested in listening to those, they're great stories over bourbon.
I mean,
Why did you look at me?
You're the one that gave me the idea for the bourbon.
Thank you. Mark, SEMSCO and CMAC.
All right, I guess it looks like I get to be the long-winded person tonight.
No, I gotta talk again here.
Okay, all right.
you are within kicking range.
Makes me feel better. All right, so the CMAC and SEMSCO met, middle of last month in Saratoga Springs. There were no real fireworks. Just a reminder, the, vehicle equipment, minimum, equipment standards went into effect in April 22nd. So the new inspections, the new spot inspections, all of that are going after, the updated list, which also includes a, measuring tape for kids. Even BLS ambulances, which is new, apparently there's been some, little bit of miscommunication on that. BLS ambulances do need a leg-based measuring device for babies, a Bronzo tape, or another version of it. There's gonna be an open position for EMSC, will be posted soon. Vital Signs is in November, Niagara Falls. There were 9 people that went on the memorial, during EMS week on the 19th. Build standards are going out for public comment this summer. Regulatory for blood is going out for public comment this summer, and performance standards will be coming out soon. And they might be looking to go after BLSFRs as well. Please pay attention to the public comment stuff. They do have to read them, comment on them, and if enough people are upset or they find a valid point, they do actually have to change it and respond to them. So please take a look at them before they become regulations, so they don't yell at you, or you don't have to yell at me when it becomes regulation. Also, cameras are not required for ambulances. They are only required for fly cars and ESAVs that are new to your agency, not new necessarily, but new to your agency after October 1st. There's a policy statement on AI. The highlight of it is basically says use your brain when you use AI, avoid HIPAA, proofread, all that good stuff. There's recruitment and retention stuff that happened that's going to be expanding throughout the state. Mental health and wellness symposium that's going on the 8th, I think it's this weekend, in Saratoga Springs. Next council meeting, as John said, is September 15th and 16th in Troy. There's some new federal DEA requirements that cover narcotics. At this point in time, they're working on some clarification. The division has been in pretty good communication with the DEA, both at the state EMS directors meeting and also locally. And as soon as there's some clarification out, it'll be going out to agencies, but please pay attention to that so we don't end up in DEA jail. There's some leadership changes, kind of above the division level. Mark Hennessy, who kind of oversaw the division of EMS among several other places, is being shifted around a little bit. And Stephanie Schulman, will kind of be taking up some of that role of overseeing the division. The state finally got tip and tag for Medicaid, so treat, place, and transport to alternative destinations. The guidance that's come out is basically work with your billing service on how to properly and legally do it. There are some documentation requirements that need to be done. There were changes to the crossovers, which is a good thing in the governor's budget that was approved. So that should be some money stuff. C1 rewrite is about halfway done. There's gonna be guidance coming out on low acuity calls. And when I say low acuity calls, I mean grandma can't get out of her car to get in the house. I'm stuck in the chair, stuff like that, with a focus on identifying and preventing and working with other stakeholders. Safety is taking a really close look at stretcher and stretcher safety, and there's gonna be some stuff coming out on that as well. They're piloting downstate, a couple of stretchers, with some different options. Basically, stretchers are not designed to be all the way up and have a full-grown adult on them, and it becomes a safety issue. They're looking at some alternatives for both patient and provider safety. Furosemide or Lasix has been put back in the formulary. It is not back in the protocol. It is only going to the formulary, so it's available for community paramedicine and mobile integrated healthcare. And shocker, there's some data integrity issues. We know that one of the things that's been identified is, and for people who've been into the back end of an EPCR system, the drug morphine has about 14 different codes associated with it, and every agency has a different code, or is using a different code because you pick one randomly off the list. The state's going to try and narrow down and get everybody on the same code, because right now, you know, if you're the off-lier that has 1, 2, 3, 4, 5 as the code for morphine, it's only picking up those specific codes, and so our data is all screwed up. So that's one of the things they're going to be focusing on. Protocols, the protocol change log is out front. They go into effect September 1st. There will be training. Dr. Daly, is going to be working on training for that. A lot of it has to do with aligning with the New Heart Association guidelines. There's some clarification in there as well. Mr. Puddle caught the rocuronium dosing change that we're gonna get some clarification on. The big one, can you bring up? Is spinal motion restriction. So
Bear with me.
there was a large retrospective study that came out that found that there's no real benefit to spinal motion restriction. Unlike other states, which have basically, for lack of a better term, outlawed C-collars and any sort of spinal motion restriction, New York State's not outlawing them, they're allowing the provider to use some clinical judgment. So the criteria that existed in the existing protocol is going to more or less remain the same. Neurodeficit, cervical spine tenderness, ALOC, intoxication, distracting injury greater than 65, paralysis, dangerous mechanism, all of those other cool things, high-speed MBAs, injections, snowmobile accidents, etc. The big difference is that it's going to say, instead of, and here's the study, it's a retrospective, there's a conclusion, and then the big wording is on the next slide, in yellow. Basically, the state, or the collaborative protocol in conjunction with STAC, which has signed off on this as well, is looking to change the should consider spinal motion restriction to may consider. Which the protocol should be in the next couple of slides. This is the current one. Boop, 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 boop. And here's the one that is not really a draft anymore. It'll be the adopted one. It sounds like there's going to be some changes to emphasize considering spinal motion restriction in patients above 65 years old. There's going to be extensive training on it. There's also going to be some outreach to facilities, so we don't have the matches of the past. This leaves it to provider judgment. You know, one of the things that was brought up was, you know, like a towel roll as an option. Soft collars may become an option down the road, alternatives to it. You know, it does also take away the, you know, tying down the drunk to put a collar on them. You know, as Dr. Daly said, it's snack anyway, you know, tie them down, paralyze them, intubate them, just so we can put a C collar on them, doesn't make a ton of sense. So it does, the big word is, consider. And, so if you do put a C collar on and you practice as you do today, you are not in the wrong. That being said, if you don't put a C collar on a patient, you are also not in the wrong. But used for the clinical judgment, there's gonna be extensive training that will come out on Vital Signs Academy that is going to be mandatory, as well as all the protocol updates that will also be required training. I believe they're looking for a June, roll update on those. I don't think I missed anything. If I did, somebody please stop in.
There will also be some extensive stuff that will go out to our receiving facilities so that they are aware of this change. And so you don't bring in a patient that's, in their eyes, should be C-collared, and they read you the riot act. So as soon as that comes out, we'll facilitate and make sure it gets out to our receiving facilities.
Any questions from the REMSCO and CMAC meeting? Just so you know, when we were there, I did follow up with Dan Clayton to see if there had been an appeal submitted for Natural Bridge. And there was no appeal submitted. So the Natural Bridge expansion of territory is done. There was no appeal that was put in for that. So we haven't heard anything on the North Star. So don't know when that's going to go forward, so. Training and ed, Paul.
Oh, we have not had a meeting over the last month or so.
Okay.
It's probably my fault too.
Noted, noted.
Old business, we already talked about the state, oh, sorry, yep,
We're really trying to get out.
yeah, Paul, Jefferson County, I won my ice cream.
The ice cream, yeah.
Yeah. Well, we're at the end of most of our courses. We've got a course started up last week. Yes, last week out at Fort Drum at the Mystic. We have a tentative original for the City Watertown Fire Academy. That's work in process. Right now, we have classes scheduled start in August for basic original and refresher public health. And then, of course, our basic and CFRs both at Fowler and Lowville at the BOCES programs. So the community paramedicine, it continues to show good success. The release from Home Care Association in Iroquois from January 24 to December of 25, ED visits or 911 calls had decreased by 64.7%. And readmissions decreased by 75.7%. That's statewide for the 7 participating agencies. So that just shows wonderful numbers. Still looking into funding alternatives as grant funding may be ending in December. We have an in-person summit on June 22nd, at which point Mother Cabrini may in fact give us a 6th year, which is unheard of. Normally, 3 years is the limit. They extended us to 4 and 5, and now it looks like they'll fund us for 1 more year, which is incredible. We had our advisory board meetings in April. Next scheduled one is July 8th. And of course, those same old upcoming events, the full-scale exercise out at Fort Drum. The MCI itself will take place on the 18th. I'm sending out a save the date for some of the agencies. Mountain Fest is in the workings. We got the fair coming up, concerts in the park. So it's the same typical summer.
Any questions for Jefferson County? St. Lawrence County. We don't have any reps on. Anybody up there give us a report? They're all looking at each other.
I can't even make it on the camera, so.
Okay. Bob, Lewis County.
Lewis County completed their EMS study. For anybody who's interested, it's posted to the Lewis County website under the emergency management tab. That was probably one of the more difficult things that we've done for as far as it goes, but it came out super, super smooth. The delivery was amazing. We utilized CGR as the company. And that was after vetting them through several other counties. They said that it was a really good experience. And it was for us as well. We thought it was gonna be a lot more cumbersome than it was. It was a lot of work for the office, don't get me wrong. Also, while we were doing the EMS study, we were simultaneously getting the emergency management office accredited through the NYSEMA and DISHES. I don't recommend doing both of those at once ever again. But fortunately, they both came out very well. The accreditation is still in standards at the state, which I expect to be there until after the SEPTA centennial. And, for anybody who's interested in that, that's the whole study. And also the presentation from the company that did it is, there's a YouTube video for it. And that'll be on the Lewis County website under the emergency management tab. We're trying to get that to align with New York State's county EMS plans. And we can't get guidance on that, and I don't expect to get guidance on it until they, take the smoke and mirrors away. But we're hoping and we're optimistic that once they do finally reveal what it's supposed to look like, that we will meet the standard. If we don't, we'll have to go back to the drawing board and we'll have to bring it back in and we'll have to make adjustments however we need to. We're gearing up for staffing, for volunteer staffing for the Lewis County Fair. That's coming up in mid to end of July. And after that, business as usual. That's about all I got.
Any questions for Bob on Lewis County? State report, Vinnie?
Just a couple things. Obviously, Michael Briggs started with this a couple weeks ago, as you're familiar with him. We are in the process of hiring somebody for the kind of Susquehanna, Binghamton area, which will help us with some duplication, especially in the event, for your situation once Michael's kind of cleared and on his own. Some duplication if he's on vacation or tied up or whatever. So while we work through the clearing process of his probation, obviously you can get a hold of me, you can get a hold of Eric. If you can't get a hold of us, absolutely get a hold of Michael and he'll pass that along. As Mark mentioned, the new 824 regs are out. I'd like to make one correction. The EASV regulation takes effect October 22nd, 2026, not October 1st.
Sorry.
It's okay. It's all good. With that being said, we've been up in the area. We continue with inspections. Agencies are doing a really good job complying with the new regulations and asking a lot of good questions. And, there's some odds and end things missing here and there, but overall, the inspections have went well. We have a new policy statement out, 2602, which came out last week, which is the high consequence infectious disease transportation operations policy. That was a tongue twister. So if you haven't seen that, with all the fun stuff going on around the world between hantavirus, Ebola, and whatever else, just take a look at that. And other than that, that's all I have, unless there's any questions.
Any questions for Vinnie from the state side? Okay, moving on. Old business, so we already talked about the state financial system. We're waiting for the budget to get approved so that we can submit those vouchers. Recruitment retention grant
All right, I'm gonna blow through this really quick. Debbie, you're gonna know everything before the meeting, because I have to present this at FDRHPO's board meeting, too. So as part of our new contract, the program agency was tasked with recruitment and retention initiatives and the paramedic scholarship initiative. So, go to the next slide. So what we're doing, we were first allotted 15,000 per region for the creation of a recruitment and retention initiatives in the region. And then the second deliverable was 20,000 per region to send 2 practitioners to become paramedics, $10,000 a student. And because we cover 2 regions, we got double the funding as the program agency. So a total of 30,000 towards recruitment and retention and 40,000 towards the paramedic scholarship program. Both of these are new requirements and came with some additional work for our office, including a market analysis, which was sent out, which then had to be submitted to the Division of EMS with a comprehensive marketing strategy and plan based off the analysis. Our market analysis showed challenges across all areas of recruitment and retention, and cited low pay and leadership management issues as to the leading causes for providers leaving. Each region was asked to pick at least one section to focus on, and a region was allowed to change that focus from year to year. And the areas of focus were recruitment of new employees to EMS agencies, recruitment of new students to EMS education programs, retention of staff within EMS agencies, and professional development of current and future leaders. And because our office is a bunch of overachievers or gluttons for punishment, we decided to tackle all of them. So what we'll go through is our objectives. So our first objective is our school-based outreach and course promotion. So what we're going to do with this is we're going to partner with our regional course sponsors, and we have already created a generic educational flyer that we'll send out to schools. And these materials will be distributed to the districts for dissemination through existing parental communication platforms, so your parent squares and things like that. There'll be a graphic that goes with it, and then a quick write-up of these are the courses that are available. Our thought on this was really twofold. By marketing to the students, we're also capturing those parents that those messages are going to. So if a kid's like, oh, that sounds really cool, I want to do that, we're also getting it in front of those parents who are thinking, oh, hey, you know, little Tommy's off at school for 6 hours a day, maybe I can do this. So just a new, different way of being able to try to capture people and get them involved. Our second is targeted marketing of the state's EMS educational pilot program. So the EMT Academy style courses, the agency internship community program, the intro into paramedicine program, and the leadership development. So by doing this, we're allowing people to go and do those internship programs. As I discussed earlier, we're working on creating a generic template program. So for the internship program. And again, this is just another way for us to market things that already exist and make them a little bit better known by helping get people in the door at EMS agencies. Next are all on one slide because I don't have cool fancy pictures for all of them. So objective 3 is a centralized application and follow-up process. So we have launched this on our website. We just have not formally pushed it out. But was to, a lot of times our office gets phone calls from providers because they mistake us as an actual EMS agency versus what we do. By doing this, we can send them to our website. They can tell us where they live, and we can put them in contact with the agencies surrounding where they live. And then we're going to actually complete a follow-up process with them. So every 1, 3, 6, and 12 months, we're going to follow up with them. We're also going to follow up with the agency, and it gives us a good view of where they are in the system. If they fall off somewhere in the system, is it an agency follow-up issue? Is it just the person really wasn't that interested and thought it was too much? The other will be with our workforce side of things here at the office. We're gonna work with Holly and create some career close-ups, that we'll share out with a lot of our other career close-up videos that we do. We just don't have any that are on EMS, so we're gonna find a paramedic from the North Country region and a BLS provider from the Mountain Lakes region, so it's equal representation of our coverage area. And create those videos. And then the other is we're just gonna do some regional EMS recruitment events. One of our plans is we're gonna try to hit every county fair in our 8-county coverage area, which will be fun, exciting, and terrifying all at the same time. To try to just spread some awareness of EMS and how to get involved with your agencies, who's around you, and hopefully maybe have them fill out the centralized application. Next is, the one that I had actually thought of first, and is gonna probably be the biggest lift of all of this, but we've made a lot of great progress. So, we did identify that leadership was kind of an issue, across the board, and that's why people were leaving their agencies. So our goals with this are to, develop a recruitment and retention plan that will, involve building leadership on our LMS. The track will cultivate confident and mission-aligned EMS leaders who can foster positive workplace culture, supporting members and reducing turnover. So the goals of this are to build a sustainable leadership pipeline by establishing a defined path for members who aspire to become officers, supervisors, field training officers, training leads, administrators. The next is to standardize leadership competency across the regions, using shared content to create a consistent leadership baseline for all agencies, reducing the variability and improving interoperability between our agencies and our region. Goal 3 is to improve retention through better culture and support. So well-trained leaders are more likely to foster a respectful line of communication, fair scheduling, conflict resolution, appreciative and supportive agency culture. And these are a lot of the top things that we heard through our market analysis of things that were driving people away. So let's try to develop some education to fix that. And our 4th goal is to demonstrate a coordinated regional recruitment and retention strategy. So by using our learning management system, which has the reach across both regions, we're able to commit to an organized and scalable professional development. And our expected outcomes hopefully will be good. And we've already entered into contract with Dan Batesy, who most of you know, he comes up to Spring Fling every year. He's gonna help create a lot of this content. He already has 8 courses ready to go for us. And then Mark Spezio, who is from Washington County, he runs Cambridge Valley Rescue. If you've never heard him speak about agency leadership, you need to. He is fantastic. So Mark and Dan will be partnering together to build the education. It'll be about 16 modules that will be rolled out by December. And then our paramedic scholarship program, so that was the other thing that came to us. So it's designed to strengthen the EMS workforce within the North Country and Mountain Lakes regions by helping reduce the fiscal barriers to advanced EMS education. The scholarship funds can be applied to tuition costs associated with New York State approved paramedic education. If the tuition total charged by the paramedic program is less than the maximum $10,000 award, any remaining scholarship funds can be utilized at the program agency's discretion. Obviously, we will take that to the steering committees because we want to ensure that we have council buy-in from this. I think that's an incredibly important part of this whole thing. Eligible reimbursements that we can look into, though, of those remaining funds are we can issue additional scholarships to people at a lower amount, but we can also look at reimbursing those people that we've already awarded the scholarship for textbooks, required educational materials, uniforms, equipment that is mandated by the program, and required certification and exam fees. All reimbursements beyond the tuition have to be directly related to compensation of the paramedic program. This also does include mileage. I did get that okay from Lynn at the state, so we can reimburse mileage if they're traveling for their lab nights or if they're going to travel for their internships where they're doing the right time. Must also be supported by itemized receipts and are subject to FDRHPO review and approval. Again, scholarship funds can't be used for personal or discretionary, items. So that was a lot, and I talked really fast because I didn't want to keep you here longer than you need to be. Does anybody have any questions about some of the stuff we're doing here? You will get a report like this every year because that is part of my contract is I have to provide this report to be able to get the money to continue to do it.
I'm really proud of you that it was not on time.
Yeah, that's, I struggled.
Any questions? We've already talked about spring cleaning, the county EMS 101 breakfast and learn. I'm working on the PowerPoint for that. Then Jonathan and I will go through that. My hope is to send that out to you folks because we'd like to start doing those in September. So I'd like council's input on the PowerPoint. So my hope is to get that out to you by the end of the month so you can review it and let us know what you'd like added, if anything. County EMS plans. We've already talked about Jefferson, we've already talked about Lewis, and we don't have anybody from St. Lawrence that can discuss it. Is there any other old business from the floor before we go on to new business? Not hearing any new business. We did submit a person for the fellowship program from our region. It was Paul Barter Jr., PJ, and PJ was put into the program. And my understanding is he is the only one that's from an agency that had somebody from the first year. So kudos for that. And he's going this weekend for that. So Brian finishes up this weekend and PJ starts. So, and you know, if they're gonna do this, they're talking about doing it again. It would be nice if some other people put in applications to us. Hopefully somebody else would like to do it. It's a year-long commitment, so it is a big commitment, so. Any other new business?
I do have one thing good. I'm just gonna tag onto the scholarship and recruitment and retention stuff. As of right now, I believe we are the only program agency other than Southern Tier that has been able to successfully spend the funds that were allocated to us we're technically going into year 3 of our contract. But we are the only one that has been able to spend our year 2 funds and, a big chunk of our year 1 funds. I have had to present to the REMO region, which is central, the Albany Capital region on our scholarship program. And our recruitment and retention, and they've modeled their scholarship program pretty much identical to us. So that's just a little quick brag of like the work that our office is doing. It's more than just the work that we do for the council and for the REMAC. Our contracts have gotten a lot more encompassing of a lot of things. So if we're a little slow sometimes to respond to you, it's not because we're ignoring you, it's because we're going in 10 different directions and trying to put out 15 different fires, with probably 14 of those fires not being in this region. And that's all I'll say about that.
And just so everybody knows, I know I said this before, but the recruitment and retention and the scholarship were supposed to be REMSCOs. That's what we were told when they were presented at state council. And they did change that, but we're very fortunate for the relationship that we do have with our program agency, and we have been involved. Some other regions, they're doing it all in a silo and they're not including their REMSCOs, so we're very fortunate that we've had the opportunity to have input on that, so we appreciate that. Any other new business? Our next meeting is October 5th.
Not really business, just information. The hospital surge exercise included amateur radio this year. And we've been in touch with them to find out what else we can do for them. On the 26th or 27th and 28th, the last weekend in June, my group will be in Clayton at the Field Day Pavilion, or not the Field Day, the Rec Park Pavilion, doing what's called Field Day. We'll be trying to make contacts all over the country and all over the world, whatever. But if you want to come out and find out something about amateur radio, and we are looking to see what else we can do besides just contact. We talked to all the hospitals and gave a report, went down to Cortland. So it's, when all else fails, we can still hunt. Just, if you'd like to come out and find out more about what we do, come on out and see us.
I'm sorry, we have a visitor here. We-
Oh, yes.
I
You wanna introduce?
apologize.
Hi, I'm Mary Sloan. I'm the new director for Seaway Valley. So I'm just sitting in because it's closer for me to come here than.
Do it, Edinburgh.
So you do what?
The director, like dock director for Seaway Valley.
Oh.
I took over for boats.
Any other new business? Could we have a motion to adjourn?
So make that motion.
Thank you, everybody. Have a great summer.